The mahogany conference table in Dad's corporate office gleamed under the afternoon sun streaming through floor-to-ceiling windows. I sat across from him in my simple navy cardigan and khakis, feeling underdressed among the power suits and expensive watches worn by his business associates. The quarterly family meeting was in full swing, Dad's tradition of mixing family dinner with lectures about building real wealth. "The problem with your generation," Dad announced to the room, gesturing toward me with his brandy snifter, "is the complete lack of business ambition. Take my daughter Jessica here. She's 32 years old and still playing nurse at some community hospital instead of building a real career." His business partner, Mr. Richardson, nodded sympathetically. "It's admirable that she wants to help people, David, but healthcare work doesn't build generational wealth." I continued eating my salad quietly, accustomed to being the cautionary tale at these gatherings. "Exactly my point," Dad continued, warming to his favorite topic. "Jessica, you've been doing this medical thing for what, 8 years now? And what do you have to show for it? You rent a tiny apartment, drive a Honda Civic, wear scrubs to work like some kind of uniform employee." My stepmother Patricia chimed in from across the table. "David's right, dear. You're intelligent, you could be running companies instead of... What is it you do exactly? Take blood pressure? Give shots?" "I'm a physician," I said quietly. Dad waved dismissively. "Physician, nurse, whatever. The point is you're working for someone else, following orders, taking a salary like any other employee. Meanwhile, look at what Richardson and I have built." He gestured toward the panoramic view of the city skyline. "Real estate empires, investment portfolios, businesses that generate wealth while we sleep." Mr. Richardson leaned forward conspiratorially. "Jessica, has your father ever explained the concept of passive income? Revenue streams that don't require you to physically show up and trade hours for dollars." "I understand passive income," I replied. "Then why are you still punching a time clock at a hospital?" Dad demanded. "Stop playing nurse and get a business degree. Learn about real wealth creation. I could get you into Wharton's MBA program with one phone call." Patricia nodded enthusiastically. "Imagine what you could accomplish with your work ethic applied to something that actually builds net worth. Medicine is noble, but it's not scalable. The healthcare industry is huge," Dad continued, "but you're approaching it all wrong. Instead of being an employee in the system, you should own the system. Buy medical practices, invest in healthcare technology, purchase medical real estate." My phone buzzed against the table. I glanced at the screen. Meridian Health Systems Executive Office. "See?" Dad pointed at my phone. "Even on weekends they're calling you in to work. No boundaries, no leverage, no equity building. Just more hours traded for a paycheck." I silenced the phone and returned to my meal. "The problem is mindset," Mr. Richardson added. "Employees think about security and benefits. Entrepreneurs think about ownership and control. Jessica, you could be acquiring the medical facilities instead of working in them." Dad nodded vigorously. "Exactly. Richardson just purchased a chain of urgent care clinics as an investment property. Passive income from healthcare real estate while doctors like Jessica do all the work." My phone buzzed again. Same caller. "Jessica," Dad said sternly, "turn off that phone. This is family time. Whatever medical emergency they think they need you for can wait an hour." "It might be important," I said softly. "It's always important when you're an employee. When you own the business, other people handle the emergencies." Dad took another sip of brandy. "That's the difference between being indispensable and being replaceable." Patricia leaned toward me with a patronizing smile. "Honey, your father is trying to help you see the bigger picture. You're working so hard for such little return on investment." "What exactly is your salary?" Mr. Richardson asked directly. "If you don't mind me asking. I'm curious what hospitals pay physicians these days." "It varies," I replied. "Come on," Dad pressed. "We're family here. What are you making annually?" "Probably around $200,000? Maybe $250,000 if you're working those crazy overnight shifts you mentioned." I took a sip of water and said nothing. "Even if it's $300,000, Dad continued, that's still employee money. Good money, sure, but you're capped by the hours in a day. Richardson and I generated more than that last month just from our real estate holdings appreciating." My phone buzzed insistently. This time it was a call. "Dad, I really should take this." "Absolutely not. Jessica, you need to learn to set boundaries. The hospital will survive without you for 2 hours. The caller ID showed Dr. Margaret Collins, Chief Administrator. I knew I had to answer. I'm sorry, but this is urgent, I said, standing from the table. Dad's face reddened. Jessica, this is exactly what I'm talking about. No successful business owner drops everything because an employee calls. I stepped away from the table and answered. Dr. Peterson speaking. Dr. Peterson, I apologize for calling on Sunday, but we have a situation that requires your immediate approval. The Board of Directors for St. Mary's Hospital is requesting emergency authorization to proceed with the acquisition of Regional Medical Center. The sellers want an answer by tomorrow morning. I moved further from the dining table, lowering my voice. What's the total acquisition cost? $340 million. This would give us complete control of healthcare services in the Tri-County area. It's exactly the expansion strategy you outlined in last month's board meeting. I glanced back at Dad, who was explaining to Mr. Richardson why employees never build real wealth. Have legal and finance completed their due diligence? I asked quietly. Yes, and the numbers look excellent. Regional Medical Center would add $180 million in annual revenue to the network. Combined with our existing facilities, we'd have a total system revenue of over $1.2 billion. And the regulatory approvals? The State Health Department has already pre-approved the acquisition. We just need your authorization as the network owner to proceed. I looked at Dad again. He was gesturing animatedly about the importance of thinking like an owner, not an employee. Dr. Peterson? Dr. Collins prompted. Should I tell the board to proceed with the acquisition? Yes, I said quietly. Approve the purchase. But I want a full integration plan within 30 days. And Dr. Collins? Schedule a meeting with the Regional Medical Center medical staff for next week. I want to personally address any concerns about the transition. Of course. Anything else? How are the patient satisfaction scores at our new facility in Hartford? Excellent. 98% satisfaction rating, and we're already seeing increased patient volume from the surrounding hospitals. Good. Email me the quarterly report tomorrow morning. Will do, Dr. Peterson. Thank you for your time. I ended the call and returned to the table, where Dad was in the middle of explaining why employee mindset was the biggest obstacle to building wealth. Finally, he said as I sat down. Now, where were we? Oh yes, the importance of thinking like an owner. Actually, Dad, that's interesting you mention ownership, I said, setting my phone face down on the table. See? Now you're getting it. Ownership versus employment. It's the fundamental difference between building wealth and just earning a living. Mr. Richardson nodded. David, maybe Jessica is starting to understand the concept. What sparked your interest in ownership, Jessica? I took a deep breath. Well, I own Meridian Health Systems. The table fell silent. I'm sorry, Dad said slowly. What did you say? Meridian Health Systems. I founded it 9 years ago. We just agreed to acquire Regional Medical Center for $340 million. Patricia's fork clattered against her plate. That's impossible, Dad stammered. You work at a hospital. You're an employee. I work at hospitals that I own. Meridian Health Systems operates 12 hospitals, 37 clinics, and 4 surgical centers across Connecticut, Massachusetts, and Rhode Island. Mr. Richardson's face had gone pale. Meridian Health Systems? The healthcare network. You know it. Know it? My investment firm has been trying to get a meeting with Meridian's ownership group for 2 years. We want to discuss healthcare real estate partnerships. Dad looked confused. Richardson, what are you talking about? David, Meridian Health Systems is one of the largest private healthcare networks in New England. They're worth billions. I nodded. Our last valuation was $3.2 billion. We employ over 15,000 people and serve approximately 400,000 patients annually. Dad stared at me as if I'd spoken in a foreign language. The phone call I just took, I continued, was approving the acquisition of another hospital system. When it's complete, our annual revenue will exceed $1.2 billion. But you rent an apartment, Patricia whispered. I own a modest apartment because I prefer to reinvest profits into expanding healthcare access rather than purchasing luxury real estate. though I do own the medical office building where my apartment is located. Mr. Richardson leaned forward intently. Dr. Peterson, I had no idea. My firm specializes in healthcare real estate investments. We'd love to discuss potential partnerships. I'm familiar with your company, Mr. Richardson. Richardson and Associates, correct? You've submitted several proposals to our real estate division. His eyes widened. You've seen our proposals? I review all partnership proposals personally. Your firm's approach to medical real estate development is impressive, but your pricing structure isn't competitive with our current partners. Dad found his voice. Jessica, this is insane. How could you own $1 billion healthcare network? You're 32 years old. I started with one urgent care clinic 9 years ago, using my medical knowledge to identify underserved markets. We grew organically, reinvesting all profits into expansion. Now we're the dominant healthcare provider in 3 states. But you said you were a physician. I am a physician. I'm board certified in emergency medicine and hold an MBA from Harvard Business School. I completed both programs simultaneously during my residency. Patricia's hand flew to her throat. Harvard MBA. Night classes and weekend programs. It took 5 years to complete both degrees, but I wanted to understand both the medical and business sides of healthcare. Mr. Richardson pulled out his phone. I'm looking at Meridian's website right now. Dr. Jessica Peterson, founder and CEO. He looked up at me. The photo, that's you. Yes. Dad grabbed Richardson's phone and stared at the screen. This says you pioneered a new model for integrated healthcare delivery. We focus on combining high-quality medical care with efficient business operations. It allows us to serve both insured and uninsured patients profitably. And this article, Dad continued scrolling, Forbes named you Healthcare Entrepreneur of the Year. Last year, yes. The room fell completely silent except for the sound of Dad's labored breathing. Jessica, he said finally, why didn't you tell us? Tell you what, Dad? That my work had value? That healthcare could be both meaningful and profitable? That playing nurse, as you put it, led to building exactly the kind of business empire you always said I should pursue. But we thought. You thought I was a failure. You thought medicine was a dead-end career. You thought I lacked business ambition. Mr. Richardson cleared his throat awkwardly. Dr. Peterson, about those partnership proposals. We can schedule a meeting through my assistant, I said politely. Though you should know we're quite selective about partnerships. We only work with firms that share our commitment to both patient care and community service. Of course. I completely understand. Dad was still staring at his phone, scrolling through articles about Meridian Health Systems. It says here you provide free healthcare to over 50,000 uninsured patients annually. We believe healthcare is a right, not a privilege. Our profitable services subsidize care for those who can't afford it. And you employ 15,000 people? 15,347 as of last month. We're one of the largest employers in New England. Patricia looked stunned. Jessica, we had no idea. We're so sorry. Sorry for what? For thinking that work only has value if it generates obvious wealth? For assuming that caring for people was incompatible with building a business. Dad set down the phone and looked at me directly. How much are you worth, Jessica? Personally. Dad, that's not really. Please. I need to understand. I sighed. My personal net worth is approximately $800 million. Most of it is reinvested in the company, but I maintain enough liquidity to fund expansion and community programs. The silence stretched for nearly a minute. $800 million, Dad repeated quietly. Give or take. The valuation changes based on company performance and market conditions. Mr. Richardson shook his head in amazement. Dr. Peterson, you've built exactly the kind of healthcare empire I've been trying to convince my clients to invest in. It wasn't about building an empire, Mr. Richardson. It was about solving problems. Healthcare access, quality care delivery, sustainable business models. The wealth was a byproduct of creating value. Dad looked genuinely stricken. Jessica, I've been lecturing you about business success for years while you were building something I could never have imagined. You weren't wrong about the importance of ownership, Dad. You just assumed I hadn't figured that out. But why didn't you correct me? Why let me think you were just working for someone else? I stood up from the table. Because the work itself has dignity whether you're an employee or an owner. The patient who needs emergency care doesn't ask about my net worth. They need someone who understands medicine and cares about their outcome. But you could have told us about the business side. When you were explaining that healthcare workers don't build wealth. When you were suggesting I abandon medicine for real business. When you were using me as an example of lack of ambition. The room fell silent again. I need to go, I said, gathering my purse. I have a conference call with our board of directors in an hour about the regional medical center integration. Dad stood up. Jessica, can we start over? Can you tell us about what you've built? Dad, I love you. But I need you to understand something. The version of me that works in scrubs taking care of patients is the same person who sits in boardrooms making acquisition decisions. One isn't more valuable than the other. I understand that now. Do you? Because next week I'll be working a shift in our emergency department, seeing patients who can't afford insurance. Will that Jessica deserve your respect, or only the CEO version? Dad looked genuinely ashamed. Both. Both versions deserve my respect and my pride. I smiled for the first time that afternoon. Good. Maybe we can have dinner next week and I'll tell you about our new pediatric cardiac program. It's something I'm particularly proud of. I'd like that very much. As I walked toward the door, Mr. Richardson called out, Dr. Peterson, about that meeting? Have your assistant call mine, I replied. But Mr. Richardson? Come prepared to discuss community impact, not just profit margins. That's how we evaluate all partnerships. Of course. Thank you. I drove home to my modest apartment, thinking about Dad's expression when he realized his underachieving daughter had built a healthcare empire while he wasn't paying attention. My phone buzzed with updates from the hospital administrators, patient care reports, and board meeting agendas. Just another day at the office.